Have you ever woken up one morning and found that half your face just won't cooperate? Your smile looks lopsided, you can't close one eye properly, and drinking water becomes a messy affair. This isn't something from a horror movie. It's a real medical condition called facial palsy, more commonly known as Bell's palsy. Bell's palsy affects thousands of people across India every year, and the scary part is that it can strike anyone at any age without warning. But here's the good news. Understanding this condition can help you recognize it early and get the right treatment. So what exactly is Bell's palsy? Think of your facial nerve as the main electrical wire that controls all the muscles on one side of your face. This nerve starts deep inside your brain and travels through a narrow tunnel in your skull bone before reaching your facial muscles. When this nerve gets irritated or inflamed, it stops working properly, causing weakness or complete paralysis on one side of your face. The most common cause is irritation of the facial nerve itself. This can happen when the nerve swells up inside that narrow bony tunnel, cutting off its blood supply. It's like a garden hose getting pinched. The water can't flow through properly. Cold environments play a significant role too. Have you noticed how some people develop Bell's palsy after being exposed to air conditioning for long hours or after riding a motorcycle without proper face protection? The cold air can cause inflammation around the facial nerve, triggering the condition. Here's something many people don't know. Dirty water entering your ear can also lead to Bell's palsy. This is particularly common during monsoon season when people get caught in contaminated rainwater or when swimming in polluted water bodies. The infection can travel from the ear to the facial nerve, causing inflammation. But these aren't the only causes. Sometimes, more serious conditions can trigger Bell's palsy. Brain tumors growing near the ear area can press against the facial nerve, causing similar symptoms. This is why proper medical evaluation is crucial. What looks like simple Bell's palsy might sometimes be something more serious. Skull fractures also can damage the nerve directly. This usually happens after severe head injuries from accidents. Other less common causes include viral infections like herpes simplex, autoimmune conditions, and even diabetes complications. The key point is that Bell's palsy isn't just one disease. It's a symptom that can have multiple underlying causes. Now let's talk about what you should do if you suspect Bell's palsy. The most important step is to consult a general MD physician immediately. Don't wait thinking it'll get better on its own. Early treatment makes a huge difference in recovery outcomes. Your doctor will first rule out more serious conditions like stroke, which can sometimes present with similar facial weakness. They might prescribe anti-inflammatory medications or steroids to reduce nerve swelling. In some cases, antiviral medications might be recommended. But here's where many people make a mistake. They think medication alone is enough. Physiotherapy plays a crucial role in recovery. A trained physiotherapist will teach you specific facial exercises that help maintain muscle tone and prevent permanent weakness. These exercises might seem simple. Things like raising your eyebrows, closing your eyes tightly, or puffing out your cheeks. But they are scientifically designed to stimulate nerve regeneration and muscle function.
The recovery timeline is usually encouraging. Most people start seeing improvement within 10 to 15 days of proper treatment. Complete recovery typically happens within 3 to 6 months, though some people recover much faster. Remember, Bell's palsy might look frightening, but it's usually temporary and treatable. The key is early recognition, proper medical care, and consistent physiotherapy. Don't let fear or embarrassment prevent you from seeking help. Your face and your confidence will thank you for taking quick action.